everything it says in the book or just the main one?
I want you to main one. Just like I say, this is calcium channel blocker. You know it's going to help the purpose. You're going to help them to slow down the rate. When they slow down the rate, the vessel dilate, the heart rate, the blood pressure up is going to drop. So you want a safety issue. You want they call you.
If you don't give this all patient education prior to medication, so if somebody doesn't say that, you're going to fail the person.
No, I will keep asking. What else?
So you open the way.
One other thing is that for these test outs, you might get a central line. So what would be different if you got?
Demonstrate central line.
What would be different if you had a central line?
You have to flush the syringe.
You don't flash.
You have to flush the
Is there a shot on there?
Perfect. Ask the instructor.
Is there a what?
Gershon.
Gershon, okay.
It makes difference. Okay, for example, exactly same case, but this patient has a central line, not a peripheral. Okay, how are we going to do?
Well, you can do it right in the IV first.
You do the exactly same thing like I. You take our medication, you check, and then you read it. Is compatible, incompatible, should I dilute, not dilute? Then you're going to pick the right equipment. For this equipment, what you should pick? 10. You have no choice. Okay, you will pick the 10. You pick the 10. Okay, I only need a 2 ml. Right? All right, when you come to the bedside, you have a lot of choice. Which one are you going to choose? You have to think. Which one are you going to choose? The one you already drinking one? Or do you want to do the other one? It's all up to you. It's all fine. Only different is you use the no is the opening one. You need to prepare. Brush before, brush after. And if not Gershon, you have the heparin. It's a lot of work, right? So now it's up to you. So for example, I'm not going to use that one. I'm going to save my time. I'm going to use this one. Okay? So I will use the pole, close the patient. Okay? And central line, you really have to do well your steer. Okay? You really have to clean. Since this already dripping, you don't check in patency, okay? And we just going to clean, connect.
Make sure your IV is going at 100 ml.
Yes. I don't check the patency because it's already running. I just want to make sure my rate, my pump is up. And I will give it 3 minutes. Like definitely you're talking about. Sometimes you like up to a little bit more, so help you. It's okay too. If you want to add on the saline, that's fine. Okay. Then you have your 3 minutes done. Then you're done.
Now, one other question, May. What if they had, you were given a bolus, and they had blood hanging? Where's our blood?
Under the cart.
Under the cart. Let's say now that we just have to give just the verapamil push, no drip or anything, and you have a blood that's hanging. Because this is the other one for test out that you could get.
You can't give anything in blood. But you can't give medication.
We have normal saline running and we have blood, and there's no way to get another line. This patient, we cannot get another line on this patient. This is the only line that we're really, really keeping this ginger because this guy has had so many IVs, has blood running.
Why doesn't he have a picket then?
Well, because the IV, no, good question. The IV nurse can't come until 6 tonight. And we have to get this verapamil in right now.
Patient's not
When we
doing
stop
well.
the blood and then flush it, and then give our push and then flush again and then start the blood again?
Okay, how are you going to flush it? Are you going to flush it with this?
No,
Way down.
disconnect
Stop it and disconnect.
Stop it.
Flush with a
Why can't you
swing.
just disconnect?
Okay, somebody wants to disconnect here.
You'd rather be safe.
And then
Disconnect
cap
it.
that,
About a
cap
cap.
that.
Tap that.
Are we allowed to screw it into the cord?
Can we actually do that? That's what I'm wondering, does the
Miss Gill, she mentioned about that she prefers, there's a reason. She tried not breaking up because you're increasing infection issue.
But with blood, you
But-
would be safe.
For the blood, I will, because this is really incompatible for safety.
Yeah, if you don't have a cap, can you screw it into the other cord?
Oh. No,
Okay.
don't do that. I saw a
Okay.
lot of nurses do that. Absolutely not.
Okay.
That's bad, bad.
What was the pressure?
They have a no cap, okay? So they will just recap here.
Yeah, but
So
that
they do,
is
yeah.
contaminated.
No, don't do it.
Yeah.
Okay.
Okay, so let's say though, could you, May, let's say that you have this hooked up and you got your blood running and you shut off your blood. Could you go like this and really, really put a lot of brisk fluid through here?
Yes, that's the other way you can do it. Make sure
Clear.
clear.
And it's going to probably take 50 to 60 cc's, don't you think, to
Yeah,
clear
so
it?
that's a problem. You will end up give a patient lots of extra.
Fluid, but
Fluid.
if it doesn't
But
matter.
you know that lots of time the blood they give a Lasix
Mhm.
because they don't want the overflow. So that's
Right.
my concern.
But you would prefer yourself, this would be correct if you flushed it really good. Really,
Correct.
really, really, really good.
Correct. That is okay. That's no problem.
Okay, but it really, 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 really good. If not, if you went through here, which you typically would not do, you'd cap this.
I capped it.
Wash this one off, and once again, you're gonna have to flush
You
it
have
a
to
lot.
flush again.
Really, really, really a lot.
Is it a lot or just with the 5
How many
ml?
cc you suggest?
It's probably from using blood in the past, it usually takes, well, for this much, probably 10 to 20 cc's at least to
She said
to
how the
get,
tubing's clear.
till the tubing is clear, yeah, and that's usually, I mean, if you've got all that extra line, it's probably gonna take a little longer. This right here, probably 10 to 20, so bring a lot of saline along with
Then we
you.
have to flush it with that much after we're done.
No, after it doesn't matter, just a few cc's is fine.
Yeah, I think
The
probably.
equivalent to whatever your push was.
You probably, when you're done your medications, about 3 minutes, then you probably 5 cc. It should be enough because your medications are inside, so you want to just finish
Yeah.
up. If you want to do a 10, that's fine.
The problem is that with blood just kind of sticks to this kind of tubing, and that's why. And the blood is incompatible with everything. Okay, so that's
Okay.
okay. Does that make sense? So those are the things. So you might get it with the central line. You might get it with blood. You might get just a regular.
You may just get like this.
Make sure that you know how to give the push and how to figure out to set the mils per hour on the machine. Are there any drops per minute? There are. Okay. What is the difference between drops per minute and mils per hour? Okay. So if you've got a machine, you're going to go drops per minute. I mean drops, mils per hour. And if you don't have a machine, then you're going to be going drops per minute. Okay?
You need to know the drip rate.
You have to have the drip rate, which is going to be on your tubing. Usually it's around 15 drops per mil. And then you just have to know how many mils you want to get in. So let's say that we want to hang it at 60 mils per hour. Okay? So then I always put what I want first. Then I always put the same thing up on top. So 15 drops per mil. And I look for another mil. 60 mils per hour. Okay, these two here are crossing out, but I want minutes.
So you gotta do
I've got drops, so, oh, I forgot,